What's happening?
She's nauseated. Here you go there.
Is the baby choking?
No. Are you having headaches?
Yes.
You are?
How long?
Oh, you mean how long do they last?
How long have you been having them?
A few days. Still 180 over 110.
Ah!
Give me magnesium sulfate.
Talk to me.
She's showing signs of preeclampsia.
What does that mean?
She could start having seizures.
Holy God.
And magnesium sulfate's going to take care of that.
Are the drugs going to hurt the baby?
No.
Hang on.
She's got to have it now.
There isn't someone more senior here that we could...
No.
Then I think we'll wait until...
Danny, she's got to have this. It is not a high-tech drug. It's magnesium sulfate. It's been around for 100 years. I'm going to stick this in her IV. It's going to reduce the electrical activity in her body. If I don't, and she has a seizure, then the cord's going to be the least of our problems.
Danny.
Do it. Do it. Do it now.
You and the baby are going to be fine.
When she entangles herself in that cord.
Yeah. I got 2 meth overdoses and a knife wound down the hall. I'll be back.
Make a good producer.
That's too much stress for me. Danny,
What's going on?
everything's fine? Dr. Bremer's got her in surgery.
Isn't this taking an unusually long time for a C-section?
I don't really know. This is my first C-section.
Excellent.
When we opened her up, we could see right away there was a deep invasion of the trophoblast into the superficial muscle. The maternal surface was irregular with variable amounts of fragmentation of the cotylins.
I don't know what any of that means.
Yeah, me neither.
Doctor?
She's bleeding internally because the placenta is still attached.
She's bleeding internally?
Yeah.
Is that life-threatening?
Well, going to the corner for a newspaper is life-threatening.
Kid, I will beat you up.
She's fine. We're gonna remove the placenta and stop the bleeding.
She's fine.
She's gonna be fine.
She's gonna be fine.
Yeah.
When would you say that's gonna be?
Well, we started her off on a local, but now she's under general anesthesia because she's at risk for seizures.
See, I hear risk, I hear seizure.
Take it easy. Go across the street, get a drink.
I can't, I'm an alcoholic.
Bummer for you.
Yeah, I know.
I'll go back in then.
Hey, listen, before you know, I said some things about your age. I said some disparaging comments about your age. You guys, you don't ever take that out on the patients, do you?
Yeah, all the time.
Doctor.
Danny, I'm Jess, okay? Everything's gonna be fine.
There's nothing you're not telling me.
No.
Okay. Wait.
Yes?
She's on general anesthesia?
Yeah.
Isn't that dangerous for the baby?
Oh, the baby's been delivered.
What?
Baby's been delivered. She's great.
The baby's been delivered?
Yeah.
The baby's out? She's here?
Yeah.
The baby's been born?
Yeah.
All right, Jess, I said there's nothing you're not telling me?
I forgot.
You forgot that you delivered the baby?
I should have written it down. That's me.
Where can I see her?
Not quite yet. She's in the NICU.
That's intensive care?
Yeah.
Why?
She's a couple weeks early. We want to monitor her heart rate and blood gases and keep her under a heat lamp.
But she's fine.
6 pounds, 2 ounces.
She's only 6... No, wait, that's exactly what she's supposed to be.
Get a hold of yourself. Do you have a friend who can come down and sit with you and just help you relax?
Danny!
Sorry, we're late. Racer X here was driving. We hit a parking meter.
You kept shouting, turn left, turn left.
Yeah, the street.
These are the calming influences.
Okay. I'm gonna head back in.
Hang on, I'll call you back. How is she?
Relax.
How is she?
I'm gonna tell you how she is, but I'm gonna use some words that sound worse than they are.
Go ahead.
Jordan was completely repaired, and we felt confident that she could sustain future pregnancies.
She was completely repaired?
She went into shock when we wheeled her into...
What happened?
Recovery.
She went into shock?
Take it easy. Her clotting factors were consumed exponentially during the initial bleeding. That means that her body can't stop itself from bleeding at the initial incision site.
So what do you do?
Well, we closed her up, but what's developed is DIC, which is disseminated intravascular coagulopathy. That's a scary way of saying that she won't clot.
It worked. I'm scared.
Don't be. The head of hematology is in charge now. He's administering drugs he has confidence in.
Is she conscious?
Yes, but extremely groggy, and we're going to keep her that way in case we have to open her up again. Danny, I promise you that I will let you know when to panic. These are post-op complications. We're going to be out of the woods by sunrise. Is there anything that I can do for you?
They won't let me see the baby.
Annette!
Yes, sir.
Get him a damn bracelet.
I can't do that, doctor.
Well, then at least let him stand outside the NICU. Let's go, for God's sakes. Come on.
Oh, my God.
Oh, no. That was from a motorcycle accident. Guy took his arm off going through Laurel Canyon. We stopped the hemorrhaging.
With the motorcycle guy?
Jordan, we stopped the hemorrhaging. The Boxamol 20 worked.
Oh, thank God.
No, wait.
What?
She developed a complication.
What are you we just went
It's a
through-
post-op infection, we think.
You think?
She has a high fever and a rapid heartbeat, and with the DIC, that indicates that she probably has a bacterial infection in her bloodstream. Now, it should become resolved by giving her IV antibiotics, which we're doing right now. But I have to tell you, there is a chance it could become worse.
How much worse?
If we didn't catch it in time, she could go into shock.
And then what?
Her organs could shut down.
What are the chances?
We don't handicap those kind of things.
What are
okay?
the chances?
Let's let the antibiotics
What
do
are the
their job.
chances?
About 25%.
I have to go see
You
him.
can't, Danny. You can't go near her. If you've got a cough or a cold or anything
How does it
remotely
happen that she
contagious-
comes into a hospital and gets sicker?
She is young, and she is healthy, and she's going to be fine.
But you don't handicap these things.
I just did. Now go be with the baby. I'll be back when there's an update.